Welcome to Adapting Class, and thank you for joining us. As usual, today is Wednesday. We're going to do some NCLEX review, some content mastering, test taking strategy. We're going to learn how to do content, and then this is a participation. So you got to participate, give me what you think, and then we go about the case. It's a content at the same time giving you case study. So what's the problem we have? HPI, that means the history of presenting. You have let's say a 55-year-old male, he presents to he has the history of diabetes, right? History of diabetes, present to the emergency room with his family. So brought in by the family, right? So by the family to the emergency room. So that's the information I've given you, diabetes patient, right? What is his complaint? The family is there, I said, he's been feeling progressively unwell. So unwell for over maybe 3 days. That is his main issue. And what is this happening? He has increased thirst, some frequent urination. Does that ring a bell? Is a diabetes patient, increased thirst, and some confusion. He has diabetes. His family said he has like poor appetite. Do you need any more information? But there's no nausea. He's no vomiting or anything like that. So it's not a GI problem. And he has no abdominal pain. These are key facts that you can use to figure out what is going on with this patient. Any more information to figure out what is going on with this patient? Okay, I give you the vitals. His blood pressure is like 90/60. Does that give you a clue? Of course, it's going to be tachycardic, maybe 112. How about that? And his respiratory rate is probably 25. The temperature, let's make it 98, right? On the physical exams, he has dry mucous membrane. Does that give you a clue? It should, right? Dry mucous membrane. The skin is poor skin fiber. I'm giving you all the things you need to know, right? And he has an altered level of consciousness. Does that give you a clue what is going on with this patient, right? Altered level of consciousness. All he does is he responds to verbal stimuli. What do you think is going on with this patient? What do you think? Right? This is the patient you're dealing with. 55, history of diabetes, unwell for 3 days, increased test, frequency urination, confusion. These are his vitals. These are his physical exams. Do you need any more information? Well, I want you to focus on this. There is no fruity breath order. This is how you do case study. You're looking for all the no's to rule out certain things in and out, right? I told you, no fruity order, right? If that's not enough, let me give you some lab work so that you can figure out. This is his glucose. His glucose is about like, let me give you 750 milligram per deciliter, right? And his pH, this is key. pH is 7.37. And then his bicarb is 20, like 20 milliequivalent per deciliter. Does that give you a clue? Ketones. So serum ketones is negative, no serum ketones. And then is our serum osmolarity it's about 300. Normal is like less than 280, right? So this is normal. What do you think is going on with this patient? Once again, 55. Connect the dots and your password. 55. History of diabetes, right? unwell for 3 days, increased thirst, frequency urination, confusion, and poor appetite. He has no nausea, no vomit, and there is no abdominal pain. Key, right? Desire is vital. He's hypotensive, he's tachycardia, he's tachypneic. His mucous memory is dry, pure skin turgor, altered level of consciousness. Those are key, right? He has no fruity breath. Key aspect of your content you need to know. You look at his lab, his glucose is 750, pH is 7.35, ketones, no ketones, osmolarity is high, and bicarbonate is 20. What do you think is wrong with this patient? What is your differential diagnosis? I see somebody said type 2 diabetes. Well, we already know the patient is diabetic. I see somebody say HHS. I see somebody say hypoglycemia. What else? What do you think is somebody say dehydration? So these are the possible, how about DKA, right? These are a possible diagnosis that you can think of that this patient is suffering from. So why would it be this? Which one do you think that is a problem? As you can see, it cannot be DKA because there's no ketones. His pH is normal. He has no abdominal pain. There's key things you should know. There's no ketones is normal. pH is normal. He has no fruity smell. And then there's no abdominal pain. All this thing telling you it can be DKA. Of course, he's dehydrated, but what is causing the dehydration? Why? What is causing the dehydration? There have to be something, right? We already know patient is type 2 diabetes, and the patient is no hypoglycemia. The glucose is like 750, right? So this is the key aspect of it that you can figure out what is going on with this patient. So how would I know that this is not this is HHS? That is the key. How would you know? What are the things you're looking for? So what is the problem? There's no ketones, okay? His pH is normal. This is making it more likely, right? The confusion is also fine, but the key word is you have somebody who is dehydrated, right? He has diabetes and he does not have ketones and his pH is normal. You know that this is not diabetic ketoacidosis because the definition of DKA is diabetic, your sugar is high, ketone, there has to be a ketone, and there have to be acidosis. And of course, his glucose is greater than 250. So that tells you it's like over 800, it's too high. But the key concept I want you to know is DKA is what? Diabetic, of course, glucose is going to be high. Ketone, there has to be a ketone. And there has to be acidosis. And this is what you will see in the NCLEX. And then they will try to give it to you, so you have to figure out. So if I try to insert the table as usual, like just to show you how they can make this thing difficult for you, let's insert the table like that. Assuming we have a table, let's make a table from here. You look at it, you said, okay, yes, which one is associated with pH of 7.5 is normal. This is the right thing. Ketones, DKA as ketones. Abdominal pain is mostly DKA. Dry mucous memory, what do you guys think? Who is going to have dry mucous memory? Who? Who is going to have dry mucous memory? Both of them, because they're going to be what? Dry, dehydration. They're both going to have confusion, but remember, confusion is mostly more for HHS, but both can have it. And both are going to have frequent urination because they have diabetes and excessive glucose. This is what is going to happen. So this is what the table is going to look like. Frequent urination, confusion, and dry mucous memory is both of them. Abdominal pain is mostly DKA. Ketones is DKA, and pH is mostly 7.35 is that. And that is what your table will look like. So just be careful how to play with this kind of question. In case they ask you, okay, so what is the, remember, diagnosis is different from nursing diagnosis. So sometimes they will give you this thing, they want you to do nursing diagnosis. It's completely different. So nursing diagnosis is different from actual diagnosis. There's two things they can ask you. Okay. What is the common nursing diagnosis for this condition? Look at what is happening to this patient. What is the major problem with DKA or HHS is what? Fluid deficit. So there is deficient fluid. So that is the key. And what is it causing to the patient? Or what is causing the fluid deficit is by what? Hyperglycemia. So this is your actual definition and osmotic diuresis. So when you're looking for nursing diagnosis in the case, don't memorize it. Just look at the condition that is happening to the patient. He has fluid deficit. That's why it's not ineffective glucose management. That's a trap, right? The problem is not because he can't manage glucose. The problem is his glucose is too high that is presenting as what? Dehydration. So the major problem is dehydration, not because his glucose is high. We will manage his glucose, but because his glucose has affected him to the point that is causing osmotic diuresis. And how is it affecting him? Is presenting like a patient who has deficit in their fluid. Therefore, your management, once again, is going to base on that diagnosis. Remember, that's your diagnosis. So my management, number one management for this patient is fluid, 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 fluid. I don't care about the confusion. I don't care about anything. I'm going to focus on that. So your normal one, the priority nursing intervention, is to give the individual fluid. What fluid do you give it? 3% normal saline, 5% normal saline. Are you going to give it 0.9% normal saline, or you're going to get D5W 0.5% normal saline, or 4-5% normal saline? So what are you going to give him? Dehydrated. So any patient that is dehydrated, he gets resuscitative fluid. Resuscitative fluid is not 3%. Resuscitative fluid is not 5%. Resuscitative fluid is not D5W. Resuscitative fluid is that, 0.9% normal saline. So that is what we're going to give this patient and manage them. Of course, these patients need to be in ICU. Make sure they're in ICU. You're checking their neurological status. You're giving them a lot of fluid to take care of the underlying problem. And this is key for what? HHS. If it were to be a DKA, it's a different way at all, but you're still going to what? Tackle this fluid phase. Give them a bunch of fluid. Then you got to deal with the potassium. Then you got to deal with the glucose. So that's a different kind of patient altogether. So HHS is a different ball game, and this is how you can deal with them. What is the main problem with this condition? Is because you have to know the pathophysiology, what is calling. In DKA, you have metabolism problem. In HHS, you have just basically osmotic problem, is hyperglycemia, hyperosmolar. That's why the difference. DKA, you have to break down your fat to make ketones. In HHS, you have too much glucose and your fluid become hyperosmotic, and it causes diuresis. That's why there's no ketones. Your pH doesn't change, and this is what you are looking for. Don't make sure you know how to distinguish between them. There's metabolic acidosis for the DKA due to the metabolism. Pay attention. It's all dehydration from hyperosmolar issue. Okay, so how do I know I have done the good job? So what is the monitoring the patient response to treatment? How do you monitor response to treatment? That you have to pay attention. Like, so how do you monitor response to that? The best way to answer this question is not get trapped. You know the diagnosis. This is not DKA. I intentionally said it like that. This is not DKA. So don't pick an answer choice that is DKA. DKA, they have acidosis. And therefore, you can see that I'm trying to trap you. A pH of, remember our pH was 7.35. Why is the pH going down? That's acidosis. It's not DKA. This one is to acidosis. So just by that, you've eliminated that. Because there is no acidosis, your potassium is not going to change. These are the key. Potassium never move. Ketones never move. Your pH never move. Three things you can use to distinguish between DKA and HHS. Potassium is not going to change. Therefore, this is eliminated. Just by elimination, you see that number one is doing much better, right? His mental status is improved. Urine output is doing okay, and then blood glucose is much better. Easy way to get trapped and then figure out what is going on. So those are the things you have to pay attention to when you see questions like that. But if this were to be DKA, it's different. So assuming this is DKA, then yeah, you have a different ball game. In DKA, like I told you, DKA, we have to worry about the glucose, we have to worry about the pH, we have to worry about the potassium, we have to worry about the dehydration, we have to worry about the glucose. So, what are you going to do? Number one, don't forget. One, give them fluid, normal saline, normal saline, normal saline. They will come in, their potassium will be high. Don't worry about it. They will be dehydrated. That is your number one. Their glucose will be high, right? Their pH, and they will have ketones, right? They have ketones in their urine. Your number one is to hydrate them. If you hydrate them, and then you hydrate them enough, because that is the signs and symptoms they came in with, then you worry about the potassium and the glucose. And what do you give them for the potassium and the glucose? Who knows that? If I am DKA, I came in and I'm in and DKA, right? I came in. The first thing you do, you're giving fluid to deal with the dehydration. Now you got to worry about my glucose and my potassium. What are you going to give them? Next thing you give them is insulin. And why? Insulin is going to deal with the potassium. This is the cell. Potassium here and glucose. The only thing that will push these guys into the cell is insulin. So you give them insulin because that's what they lack in. And that will push glucose inside the cell and potassium inside the cell. So that is the second thing you give them. You keep on doing that until your glucose is close to 250, right? As soon as it's less than 250, within 200, then you give them glucose back. You change this fluid to D5W normal saline because you don't wait until they become hypoglycemia. You can give them albuterol to push potassium inside the cell, but most of the time they're getting insulin. And when their glucose is getting close to 200, that's why you start giving them glucose before they become hypoglycemia. And at that time, you start replacing their potassium. replace potassium at that time. You don't do anything with the potassium because when you give them insulin, it's going to take care of it. This is content related to DKA and then HHS. Don't let them trap you. You need to know how to manage this patient. You need to know how to figure out this. Last information. How would I know a DKA patient is doing well? What are the things you want to look for to say, hey, this DKA patient is no more in DKA? What are you going to look for? Regular, remember, is DKA. Therefore, your glucose should be normal. Ketones, no ketones. And A, acidosis. Don't pick urine output. It's a trap. Remember, when they came in, their urine output is already high. So why would you use urine output as a form of what? Gauging if they don't have DKA. And I made it easy. DKA, to answer a DKA question, go back to the acronym, Diabetic Ketoacidosis. If you're doing well, there will be no diabetes. That means your glucose will be close to normal. If you're doing well, there's no ketones. If you're doing well, there's no acidosis. How do I know I've resuscitated you well? There's no, your glucose is normal, your ketones, none, and you have no acidosis. Your urine output is going to be still high. You cannot use urine output as a gauge for what? DKA resuscitation. And the last thing, make sure you use what? Regular insulin. Don't pick NPH or anything like that. This is content related to DKA and HHS, and I want you to master this as much as possible. You got to know the difference between them, how to distinguish between them. Few information. And before I go, last one, so that I can distinguish them again for you, so that you can know. Let me draw a simple table. As usual, the same thing. Who has Cushman breathing? Whose pH going to be 7.35? Whose bicarb is going to be 24? Who is going to have metabolic acidosis? Who is going to be dehydrated? Who is going to have confusion? Who is going to have fruity smell? Who need ICU care? Same thing. This is to summarize everything before I leave you guys. Well, all of them going to need ICU care, right? Who is going to smell fruity? DKA. Who is going to get confused? Both of us, if it's severe. Who is going to get dehydrated? Both of us. Who is going to have metabolic acidosis? It's DKA. Whose bicarb is going to be 24? This is normal, HHS, because there's no acidosis. Whose pH is going to be acidotic? DKA. Who is going to have Cushman breathing? Cushman breathing is designed to take care of the pH. If you have metabolic, if you watch my EKG acid-base status acidosis, you can tell that if you have metabolic acidosis, in order to compensate, you do metabolic, you flip it to respiratory, and acidosis, you become alkalosis. What is respiratory alkalosis? You breathe fast. So deep, rapid breathing is a Cushman breathing, and it's just adaptation. And therefore, this is DKA. This is adaptant clause. I know you learned something. Take care of yourself. And I said, if you want to join our class, you're welcome. You can email me. Take care and good luck. If you see any question in DKA, HHS, this is the concept you need to know based on the management and how to recognize them. Have a nice day.